There was some really exciting data presented at ASCO 2024 on TILs. Certainly, I think one of the areas that got the most attention was the first in human trial of OBX115. And that's a genetically modified TIL that is engineered to express membrane-bound IL-15 that's under the control of a drug regulation domain. The goal of that TIL treatment is to potentially not need to give patients IL-2 because those TILs make their own cytokine signal. And the data were beautifully presented by Dr. Rhoda Amaria, who's a member of the TIL working group, for the first 10 patients treated with OBX115, and really promising early data in pre-treated melanoma patients who had all progressed on checkpoint blockade. 4 out of 9 patients that responded, including 2 patients with complete responses, and really much less toxicity than we are used to seeing with a IL-2 based TIL regimen. Minimum cytokine release syndrome, certainly no IL-2 toxicity. The patients did have lymphodepleting chemotherapy, and so the hematologic toxicities were there as we would expect. But I think a lot of enthusiasm for an approach that's IL-2 sparing, or in this case, completely negates the need for IL-2. The other piece that was spoken a lot about this abstract was the potential to harvest the TIL from core biopsies rather than requiring a full surgical resection. So obviously very early data, early days for this new phase 1 molecule. But the phase 1/2 trial is now open and accruing at multiple sites around the country, including ours at Stanford. And I think the field was very excited to see where we're going with this. Additionally, the other TIL abstract that received a lot of attention were the first patients treated in the first line with TIL plus pembrolizumab. And these were patients from the iAdvance COM202 trial, from the basket trial, and early signs of good efficacy in the front line. But I think this was highly controversial in discussions, just about the role of TIL in the front line. Even the idea of combining TIL with a checkpoint inhibitor, received a lot of discussion. While checkpoint inhibitors may make TIL work better, and I think that's yet to be seen, one of the appeals of a TIL approach is a one and done treatment. And so to add then to 2 years of checkpoint inhibition, raised a lot of discussion about whether, where we are going with TILs in the front line. That trial is being followed up by the ongoing and accruing TILVance trial, which is the confirmatory phase 3 trial for lifileucel. So I think a lot more to come in this area. We also saw some nice data in poster presentation form about cytokines and some correlative analyses of TILs that I think will drive some of the scientific discoveries we're going to see in the coming years.